Today, we're diving deep into one of the most common fertility tests for women. The fallopian tube test, also known as the HSG test. If you've been trying to conceive or preparing for IVF, this is one test you'll likely hear about. In this video, I'll explain what the tube test is, how it's done, how to prepare, what it feels like, and what your results actually mean, so you all feel confident and ready before your appointment. The HSG test stands for Hysterosalpingography. It's a special type of X-ray test used to check if your fallopian tubes are open and if your uterus is normal. The fallopian tubes are the pathways that connect the ovaries to the uterus, and if these tubes are blocked, the sperm and egg can't meet, making pregnancy difficult. This test helps doctors find out if there's any blockage, scar tissue, or unusual shape in your uterus that might be causing fertility issues. Doctors usually recommend a tube test if you've been trying to get pregnant for over a year, you've had miscarriages or ectopic pregnancies, you're planning for IVF or IUI treatment, or your doctor suspects blocked tubes due to infections, surgeries, or endometriosis. The HSG test is done after your period ends, but before ovulation, usually between day 7 to day 10 of your cycle. That's because doctors want to be sure you're not pregnant and your uterus lining is thin for a clearer X-ray image. Let's talk about how you prepare for the test. Take a mild painkiller like ibuprofen an hour before the test. Avoid using tampons or having sex 24 hours before the procedure. Some doctors may give you an antibiotic to prevent infection. Eat a light meal. No fasting needed. Carry a sanitary pad, because there might be some spotting afterward. Also, wear comfortable clothes and bring someone along for support, especially if it's your first time. Here's exactly what happens during the test. You'll lie down on an X-ray table. Similar to a pap smear position, the doctor gently inserts a speculum into your vagina to see the cervix. A thin tube called a catheter is inserted through the cervix into your uterus. A contrast dye, a liquid visible on X-rays, is slowly injected through the tube. As the dye fills your uterus and fallopian tubes, X-ray images are taken. If the dye flows freely into your abdomen, your tubes are open. If not, there might be a blockage. The entire test usually takes 15 to 30 minutes, and you'll be able to go home shortly after. This is one of the most common questions. You may feel mild to moderate cramping, similar to period pain, when the dye is injected. For most women, it's uncomfortable but bearable, lasting just a few minutes. Deep breathing helps, and taking a painkiller beforehand makes it easier. In most countries, the cost varies depending on the clinic and city. In India, $2,000, $5,000. In UAE, 400, 900 AED. In USA, UK, $100, $500. Always confirm if it's included in your fertility package. After the test, you might notice mild cramps, slight, spotting a small amount of discharge. These are normal, but call your doctor if you experience heavy bleeding, fever, or foul-smelling discharge, as these could indicate infection. You'll get your results either the same day or within a few days. If the dye passes through both tubes, great news! Your tubes are open. If it doesn't, your doctor might discuss further options, like a laparoscopy for detailed examination, or going straight to IVF if both tubes are blocked. Interestingly, many women get pregnant naturally within 1 to 3 months after the test. That's because the dye sometimes helps clear minor blockages. So don't lose hope. This test can be both diagnostic and therapeutic. To summarize, the HSG test helps check if your fallopian tubes are open. It's safe, quick, and gives your doctor vital information for your fertility journey. Some mild pain is normal, but it's over soon, and the results can guide your next steps. If you found this video helpful, give it a thumbs up, share it with someone who's preparing for fertility treatment, and don't forget to subscribe for more women's health videos.